We good to go? Okay. Well, good afternoon, Queensland. As we reported in the Parliament this morning, we have 2 new cases in Queensland. One is overseas acquired and in hotel quarantine. We do have a second case, which is a truck driver who lives at Windaroo, and he became infectious on the 27th of August, and he travels through New South Wales and into Queensland. He's currently back in New South Wales. He was infectious in Queensland during the periods 28th of August to the 1st of September. We are still seeking to interview this gentleman because and we understand he is on the road still in New South Wales, but we are testing his close household contacts. That means we've got 19 current active cases in Queensland. We did 10,433 tests and 21,086 vaccines. We do have another gentleman who isn't counted in our figures because it's a New South Wales case. This gentleman lives in New South Wales, was tested in New South Wales. However, he did travel to Queensland for 1 day while he was infectious. And he had gone to Goondiwindi, Archerfield and Bundamba. So we do ask people in those areas to please check the website. But we're also saying because the other gentleman lives in Windaroo, anyone on the Gold Coast should come forward if they have any symptoms. Of course, that goes for anyone in Queensland. We still continue to encourage anyone who's got any symptoms. We also reported this morning there is a family of 5 who we believe lives in Queensland but has travelled down to Melbourne and back again by road. They have children at the Australian International Islamic School, which is how we became aware that they had travelled illegally through back roads to get into Queensland. That school has been closed today, and I'll get Dr. Young to just update you a bit more about what actions we are taking. Unfortunately, the family have not agreed to be tested at this point. So we do have to be careful and assume that they could be positive as some family members are unwell. So we are taking the most cautious measures possible because they have been travelling in Queensland. The children have been out of school, and we need to make sure we don't have a situation where we have transmission happening in our schools and our community. And as we get more information about this family, of course, we will make sure we put that up on the website. But because they live on the Gold Coast as well, we do ask people to come forward, particularly on the Gold Coast, to get tested if they have any symptoms. I'll hand over to Dr. Young now to expand on those cases.
Thank you very much, Minister. So yes, we do have a number of concerning incidents that are evolving, and we're getting more information. But the most important thing is that anyone with any symptoms, it's really critical that you come forward and get tested. So we first have a truck driver who is undergoing his weekly surveillance testing. He was tested here at Pimpama in Queensland, and the result came back positive. But of course, as it's surveillance testing, he continued working before he got that result. So he was actually here in Queensland for 5 days while infectious, and we're just working through with his household to urgently test everyone in the household, and we're trying to contact him so we can find out what exposure venues there have been. So that is concerning, given that it's happened over the last 5 days. Then we have these other truck drivers that have been positive. We've had quite a few of them recently. The most recent one that I am concerned about is one that New South Wales tested and let us know about late yesterday, and he is actually here. So we were able to get information from him, and we've put up a number of exposure venues on our website. And again, could people please check those exposure venues and come forward for testing if they were there at the times that are listed. That's very important. Then we have this family, 2 adults and 3 young children under the age of 10 who travelled down to Melbourne and returned, we believe. Police have informed us that they have information that they returned around 3 days ago, and 2 of the children went to school. and those children told their classmates that they'd recently been in Melbourne. So police then attended the school yesterday, and the family of 5 is now in hotel quarantine, and we're working with them. I'm sure that they're concerned and they're worried, and we're trying to work through that with them. At this stage, they have not agreed to be tested. So therefore I've had to ask that all children who attend that same school need to go into quarantine until we're able to get a test result from these 2 children. If we can't get those 2 children tested, then that school will be in quarantine for 14 days. At this stage, I've asked that only the children need to quarantine in their home, with a parent, of course, staying with them, but the whole household doesn't need to quarantine unless, of course, we get any positives out of any of the children who attend the school or the family. Then we'll continue to work with that family to encourage them and support them to get tested, because that's critical, because we actually don't know what we're dealing with. Thank you.
Are you concerned about children under 12 contracting COVID and the risks of it?
Yeah, I have become more concerned about younger children. Last year we saw that young children were very unlikely to get infected. This year with our Indooroopilly cluster, yes, I know it was based in a school, so of course you're going to get more children by definition. But even so, we were seeing a lot of children getting infected, and within families, all the children getting infected. And although the vast majority of children have very mild disease, which is good and reassuring, as we start to see more and more children infected, we will expect to see some more serious cases. That's certainly what has happened overseas. But yes, at the moment, there's no doubt that Delta does affect children more than previous variants did, and thank goodness to date most of those children have had mild disease. But as we go forward, we'll of course have to make sure that we work with our communities to be alert that if the child deteriorates, that they do need urgent care. At this stage, no studies have been done on children under the age of 12, but that will happen, of course. That depends on what those studies show, and it also depends on what is the best outcome for children, whether it's better to vaccinate them or whether it's better for them to have an infection. We don't know any of that yet. That work's still to be done. They're the figures. You can see them in the website. I'm sure you've looked at them. The Doherty model is up there for everyone to see. And if you go and look at that modelling, remember it's modelling, but it's based on a lot of assumptions that I do absolutely agree with. And it shows that if you weren't going to mitigate an outbreak, if you start from day 0 through to day 180, by day 180, if 70% of the population was vaccinated, you would start seeing 80 deaths a day. That's the modelling.
That's the absolute extreme, isn't it? With no mitigation.
Have a look at the modelling. So it depends. That's why, if you remember, that the Doherty modelling was saying that even when you get to that 70 or 80%, you probably still need to use lockdowns and other strategies judiciously, but you probably still need to use them. Otherwise, you would start seeing those results. Yes. Well, I believe it is. You've got to look at the extremes. It's only if you look at the extremes that you can then work out what you then need to do. And that's what modelling does for you. Modelling gives you the extremes. Modelling shows you if you don't do anything what will happen, if you go and lock down what will happen. And we're seeing that happening today in New South Wales and Victoria.
Have you made any proposals to the Premier about keeping particular lockdowns or anything in place in order to protect us, the children?
No, not at this stage, but we haven't seen all that modelling which the Premier has clearly requested, which is important that we see.
Is there any update on the possible exemption for that young boy?
Yes. I saw that in the media this morning. Thank you for sharing that with everyone. He hadn't, or his parents or grandparents hadn't actually approached us for an exemption, so we've now been able to sort it all out. Yes, of course he's been given an exemption. We wouldn't leave a child in another state, but we have to be asked to be able to give an exemption. He will need to come with an adult. We would usually expect that. Pardon? Well, he will have to fly from where he is to where his parents are, yes.
Do you have sympathy for all those Queenslanders who are still locked in New South Wales?
Oh, of course I do. This is awful. We've not done it before in Queensland. We've always managed to allow Queenslanders to come home. But this time we just couldn't continue to safely manage it. The Delta variant, for those of you who haven't worked it out for me, I'm very, very concerned about. It is a different variant to the one we were dealing with last year. So we've had to ramp up all of our mitigating factors, and we just could not continue to take those enormous numbers of people.
Back to the Gold Coast, if I could. There was a reporter there who said that they've been to a testing site. Somebody said that they were in contact of the truck driver, and that the truck driver had been closed because of the closing time. And I thought he hadn't been spoken to.
Well, I imagine that the truck company knows he's one of their drivers and so therefore has responded very, very appropriately. That's, can I say, why things work in Queensland? People don't wait to get a phone call to do something. If they know something needs to be done, they do it immediately. So thank you very much. Yeah, of course.
Can I just ask on the family, you heard in Parliament they're unwell. Is it all the family that's unwell or only some of them, the border jumping family?
Just some of them have got those symptoms, because I told you the 3 kids are under the age of 10,
Yep.
and kids that age regularly have all sorts of
all
symptoms.
3 children that are sick?
I don't have all that
And
information.
do you know where they crossed the border approximately?
That's what we're working with police over.
Is it suggested they came through New South Wales or they went sort of around?
Oh, they came through New South Wales, yes.
And which quarantine hotel are they in?
I don't know. Yes,
How do you know they have actually been involved?
because police have been involved.
Dr. Young, we're striving for that 80% vaccination.
Yeah.
Do you envisage that children will form part of that 80% vaccination threshold and not currently? Do you envisage that?
At the moment, the threshold is 16 years of age and older.
But do you envisage children will one day be?
That's a National Cabinet decision.
The Queensland Health website has some advice around children, around COVID. It says that it's not particularly, badly felt for children. Is that advice still right?
Yeah, I just went through all that. I'm happy to go through it again. Okay. So COVID-19 affects children differently. So last year we saw that children got very mild disease. In fact, very few got infected. And that's why schools were kept open. Now we've got new variants, and the most recent variant that we're dealing with today, of course, is the Delta variant, and there are other variants that we're seeing mutate and evolve across the world. With the Delta variant, we've seen that children are much, much more likely to get infected. We saw it here in Queensland most recently with our Indooroopilly cluster. We're seeing it today in New South Wales. We're seeing more and more children get infected. Thank goodness the vast majority of those children have very mild disease. But once large numbers of any group in society get a disease, you eventually do see the outliers and you see severe disease. So that's something that parents are going to have to take note of, and they're going to have to make sure that when they look after their child, as they do with any other viral infection, that if the child deteriorates, they need to get urgent medical help.
So New South Wales and Victoria both said they can't get to 0 cases. Are you ever
The most important thing we need to do here in Queensland today is get as many adults 16 years of age or older vaccinated. So I know that the target that has been set by National Cabinet is 80%. I would like to see much more than that. If we can vaccinate 95% of our little ones, of our children under the age of 5, I'm sure we can do better with our adults. So that's what I am pushing for. Whether or not we need to have any additional mitigating factors in place. Once we reach 80%, we'll have to wait and see what the modelling shows us.
For that modelling from the authorities to be done, has Queensland Health doing any of its own modelling around that control?
No, National Cabinet has asked the Doherty for that modelling to be done. And yes, we do model depending on what information we get from that national modelling. We then look at what that means for Queensland.
That modelling then and what we know about the impact of Delta so far, what down south, in the same way it's still likely to only be a mild or post-traumatic illness in children. Is it responsible for the Premier to come out and speak in the way that she is?
Of course it's responsible for our Premier. Our Premier has to make sure that our population in Queensland understands what the risks are, and I totally endorse that. We need to get as many people in Queensland as possible vaccinated. We are nowhere near where we need to be. I am very worried about all of these cases I'm dealing with every single day. So today we've got this family of 5. I have no idea whether any of them have been infected and where they've been in the community. Then I've got this truck driver who's done all the right things. So he's done his surveillance testing, but despite that, he's been in the community for 5 days while infectious. Then I've got another truck driver who spent 1 day in the community while infectious. We are going to see spread. And if we don't have enough people vaccinated, and we don't today, we will see what is happening in New South Wales and Victoria. It's just a matter of time. It could be tomorrow. So everything and anything that encourages people to get vaccinated by understanding the risks that they're facing is vitally important.
Mental Health Minister Greg Hunt has said that the treatment uptake department that I was talking about 80 deaths a day by consumption breached good faith and damaged public confidence. Do you dispute that?
It's the same answer I've just given you. We have to be open, and that's what I absolutely appreciate about working here in Queensland, that we put all of our information out there. So I'm here nearly every single day talking to you, talking to our community, and I answer every one of your questions, and I will continue doing that, because the more information that is out there and the more that people understand, then they can understand why we do what we're doing. Then they can understand why I needed 19,000 people to quarantine in their homes for some of them for a lot longer than 14 days. And they did it, and they did it brilliantly. Now, I haven't done the research because I don't have the time, but I hope some universities do it for me to find out why did those 19,000 people do that? And why aren't people in other states doing that? There's something different here, and I genuinely think it's about the information that we share, and the information, and you should be proud of it as well. You ask me a lot of difficult questions, but they're sensible and useful questions. You should be proud of getting this information out there. We should share everything, and that information that the Premier shared is on a public website. Any of you and anyone in Queensland can download it. That's where I got it. I didn't get it as a special bit of information, secret or anything. I just went to the website, Googled and downloaded it. So any of you can do that, and please do. Go and look at it yourself and start making decisions about what you think the risks are for you as an individual, and then perhaps more people will come forward and get vaccinated. They've got some symptoms, but I don't know if they're anything to do with COVID. You've got to remember there's 3 children there under the age of 10. And for any of you who have children, I've had 2, they're forever having symptoms of something or another. So I don't know if they've got COVID or not. That's why I need them tested. So I desperately hope this family will allow us to test them. It's critical.
Are you worried that Queensland children will die during the outbreak?
It's a possibility, yes.
On exemptions, Greg Hunt has said today he's described it as a profound moral failure in terms of letting NRL players and their families in, but then kids not like them person, cancer patients and whatnot. What's your reaction to that?
Well, those NRL players came into their own hotel. It was not a Queensland government hotel. So if they hadn't have used that hotel, all that would have happened is we wouldn't have had those NRL matches. And maybe that's what people would prefer. And that's another thing I'd like to understand what the population's view is. They have their own separate hotel that they have 100% funded, that they have run with private security that has been approved by police, with private healthcare that I've approved. So it's totally separate to any of the hotels that the Queensland government has run.
Well, does the minister know how many?
Are we going to be able to open up to
That's a totally different question. The first one is we need to get 80% of our adult population aged 16 years and over fully vaccinated. That's what we need to achieve. That's the plan.
There are Queensland travellers who've been limited by restrictions. They came from the border, and the New South Wales Cross-Border Commissioner said that the solution is needed for these displaced people. What is the government doing to help?
I need people to understand that I do not want to make New South Wales' job harder than it is. So I have never allowed people to travel through New South Wales and camp on the border. I've always insisted that they must fly because they are at real risk of seeding outbreaks along the border. So they can't stay there. They need to go back to where they came from and apply for an exemption, as that young boy's family has, and they will fly from where they are into Queensland. And that has always been our process. The only people who can travel by road from New South Wales are people who live in that border zone, because they're already there, so I can't be held accountable if they've got COVID and they spread it. They are there. But for other people, I have never ever, we're now 19, 20 months into this pandemic, I have never allowed people to travel by road. So when we were closed to Victoria, people in Victoria had to fly to Queensland. They weren't allowed to travel by road through New South Wales. And people from Sydney have never been allowed to travel by road up into the northern part of New South Wales. I've never wanted to do anything to make the job harder for New South Wales. So my plea to those people and to the Border Commissioner to work with those people is they should not be there, and they need to stop coming into northern New South Wales. I do not want to see COVID in the Tweed. That's the whole point of why we're trying to create a bubble with that northern New South Wales area, and we can't if there are cases there.
Last couple of questions.
Know how many Queenslanders are seeking or trying, Queensland residents are trying to return back home to the state? What that
I'm not sure, because I'm not quite sure what the definition of a Queensland resident is. That's something we've always struggled with. So that's why we've always been very, very clear. It was Queensland residents or people seeking to relocate to Queensland, rather than, is someone a Queensland resident who lived here a year ago? So there's about 3,000 in that combined group.
And what's the split is between the two?
No, that's what I'm saying. It depends. It depends what your definition of a Queensland resident is. A kid who's been down in Melbourne for a year and coming back home, are they a Queensland resident? I think they are, but maybe they're not. So it's 3,000 in total who are choosing to relocate or return to Queensland.
You previously indicated it would take one case and where's that situation at now?
That's what I'm very worried about. So I am very concerned about this family of 5 who's been in Melbourne. I just desperately want to be able to test them, because otherwise that's very complicated. And then I'm less concerned about the gentleman, the truck driver, who spent 24 hours infectious in the community, because it was mainly truck stops and petrol stations and his work where he was offloading his truck. So I'm less concerned, but of course we're contact tracing and testing everyone. And then I don't know what my level of concern yet is about the gentleman who was here for 5 days while infectious, because we just need to find out if he followed the freight protocol, which it sounds like he certainly has been, because he got tested every 7 days and I have all those results. Then hopefully if he stayed at home, then it's his family who really are the main risk, and we're testing them urgently. So I just have to wait and see. Yes. Yes.
Well, I'm pleased that the inquiry has been launched. It is appropriate that the board chair initiates such an independent investigation. I want that to occur quite quickly. It is important that we give the public confidence, and I want to have confidence that what is happening at the hospital is the best quality of care. We know there's complications from time to time and things can go wrong, but I want to know if there's any systemic issues. And the reports that we've seen coming in over the last 4 days, are serious enough to warrant an independent examination of what is occurring in the practices and the complaints. And so again, I say to anyone who does have a complaint or concerns about the quality of care they've received at the Caboolture Hospital to come forward through one of the phone lines or the email contact we have set up. Yeah, look, because up until yesterday, I had been provided with responses relating to the complaints that had been reported on. The colorectal complaints, which led to, I believe, one death, had gone to the coroner, and the coroner had chosen not to investigate, and that they had also done a review that showed that it wasn't one single surgeon that operated on those cases, so there wasn't an obvious systemic problem where a single doctor was constantly having problems and serious outcomes with the surgery. But what occurred yesterday was this claim that a doctor was operating outside of a scope, that a complaint had been made to the Executive Director of the Caboolture Hospital in relation to that complaint, and I asked for information to satisfy myself, as did the Director General. Had that complaint been received? Had it been properly followed through? I was not satisfied with the response that I got overnight. So I cannot have full confidence, and if I can't have full confidence, the public can't have full confidence that all proper processes have been followed in relation to complaints because of this most recent incident. So it is important that we get to the bottom of this and we do properly, independently review what is happening.
We've got to go now, guys. We've got a condolence motion.
Oh, look, I don't want to preempt the review, but I will say that there wasn't clear evidence that this had been thoroughly investigated in relation to the complaint.
Thanks, guys. We've got to go now.
Sure. One.
Is there any evidence that you're aware of that any states are looking at opening up at 70% vaccination with no mitigating factors?
Well, can I say this? I think it would be helpful for people to go have a read of the Hansard in Parliament and the sorts of comments made by the opposition.
They're not in government.
No, but they are part of the same party that is running the country. The Morrison government has certainly been talking about the 70 and 80% and being able to open up and stop lockdowns. And now that has been parroted here this week in debating the public health bill. And there's statements made like, once you get to the 80%, the national plan says no more lockdowns needed. That is not true. And we need to be honest with the people of Australia. And we need to be honest with the people of Queensland. The national plan and the Doherty Institute modelling clearly says that when you get to 70% fully vaccinated, then there are less likelihood for need of lockdowns, but they'll still be needed. Then you get to the 80% and it says they're less likely still, but they would be more targeted. So there is no modelling and there's no national plan that says you get to 80%, there's no lockdown required, no restrictions required. So I just think I appreciate New South Wales and Victoria seeking to give hope to their community, but the view that we're going to get to 80% and all these economies are going to open up is just not factually correct. They will lift restrictions when they get to 80%, but what those restrictions look like will depend on the cases that they've got still going through their community. And the Chief Health Officer has said this time and time again, so has the Premier, based on the Doherty modelling. Simply hitting the 80% target is not in itself the only thing to consider. You have to look at how many cases are in the community, is there community, is there links to those transmissions, how many cases are showing up, all of those things that we look at every single day, and the Chief Health Officer reports on every single day. It is going to be very different if we hit 80% and Queensland still has 0 cases, as opposed to 80% and there's 2,000 cases a day, and your hospital systems are overwhelmed. It is so sad and distressing to see New South Wales just brought in that guideline talking about having to make the decisions, who is more likely to live, in deciding who gets assistance and ventilation. That's what we've seen happen overseas. We want to do everything possible to avoid that happening here. So it's not just about the 80% target. It's about what else is happening, how many cases, what transmission is happening in the community, and whether there's links there, and whether you are comfortable that you can contain and control the virus that is happening.
Great.
Thank you. Thanks, everyone.